One extra NEC from Akash.
As foods in India in the coming years? You can answer from there, please. We hope to have some take-home messages from this panel discussion, wherever possible.
Well, it has been known that since yesterday, that most of the speakers said that we need to do a lot of work on the probiotics. See, I have been working on the ethnic fermented foods for last 28 years, the entire Himalayas and Asia also. We know about the milk, the fermented milk they have probiotic properties, mostly including the lactic acid bacteria and some non-lactic. But since we have our own ethnic food, there are many fermented ethnic foods. And we found that some of the native microorganisms have the probiotic properties. In India, we have done only up to the identification level and the few the properties of the probiotics. But in Asia, that Professor Nano was telling about the tofu. Tofu is not a fermented product. Especially the Japanese eat the fermented soybeans, that is the miso, natto, and all. There are a lot of literatures and a lot of research has been done on the probiotic activities. Similarly, in Korea also, the kimchi, the fermented vegetables, and chungkokjang, and the fermented soybeans, they have done a lot of work on the thing. In African also, the fermented beverages, the Bantu beer and all, they have been reported to have the probiotic properties. And I'm sure that in India, besides the dairy products, we have some fermented soybean products in the Northeast. Recently, I have written the review paper on the Indian fermented soybean products with the health benefits is being published in the Journal of Ethnic Foods, published by the Elsevier. And there are many the non-dairy fermented ethnic foods. And I'm sure that I'll come to the conclusion that we need to do a lot of work, mostly the identifications and the molecular tools, especially the culture-independent technique and the next generation sequencing, metagenomics, and other techniques. Because the identity of the particular microorganism is very important. Then ascertain that these microorganisms have the probiotics. Now the probiotics is not only the functional property for claiming the health benefit. There are so many other things. Professor Nano was telling about the isoflavone. We have been working on that also. There are biopeptides also. There are polyglutamic acid production. There are so many others, the parameters, and this will make a holistic, the health properties and all. Then second thing is, very important thing is that some of the researchers are working on the animal models, but clinical trial has not been done here. Just last month, I was in the Chumbuk National University Hospital in Junsu in South Korea as a visiting professor. I was in the Center for Clinical Trial Center for Functional Food. Beautiful. They have got everything, and what they are doing is that they are working on the traditional food, the fermented food of Korea, and they have published a lot of work on that, and claiming that health benefits, including the probiotics also. And I've got all the protocol and everything, they have made all the protocol and all. And I'm sure that in coming days, there's some of our medical universities and some of my colleagues in the other universities, I think we can establish to have the clinical trial center, which is very, very important, focusing on the ethnic Indian foods.
Talking of probiotics in foods, there's a lot of recent published data on probiotics and obesity. In this context, lifestyle has a direct impact, foods have a direct impact on lifestyle. And Dr. Rama Chaudhary, to what extent would probiotics impact on quality of life, and your views on how they can modify lifestyle diseases?
I think today's presentation was has made my task easier. Dr. Naino's presentation, and what we have done some metagenomic studies in obesity and lean people, Indian people, and we have found that in the obese patients, the Firmicutes or the Clostridia group is very high as compared to the Bacteroides group. So this is the initial marker that not only in obese patients, then coming to the hypertension, the diabetes, and ultimately leading to colon cancer. There is a trend towards decrease in the, what you call it as lactobacilli and the Firmicutes, but the Bacteroides and others balance is getting disturbed, and that is what is actually leading to the whole problem. The problem comes when the bacteria which are harvesting the energy from the food, they are affected. The metabolic end products are affected. Then the genes which are responsible for insulin resistance receptors, they are getting modified. And above all, the carcinogenic effects are getting enhanced in absence of the normal healthy microbiota. So the role is so interlinked that once you start looking at the microbiota, you realize the whole problem starts with obesity. And obesity is the beginning of the whole issue. And when you are able to have healthy lifestyle, where you are able to maintain good food habits, starting from general exercise and good food, the whole microbiota is responding accordingly. So the ultimately effect comes to whether we are able to maintain that balance of healthy bacteria in our body. The very fact someone talked about in C. difficile associated diarrhea, fecal transplant, which is becoming a very important therapy these days. The reason is that we are giving a balanced microbiota. It may not be a question of just one organism or one bacteria which we are giving. We need to have balanced microbiota so that the balanced metabolic end products which are required for the healthy gut are provided. So now the question is not just this one microbe or that microbe, it is the ultimate outcome of the metabolic end products, how they are interacting with each other, how they are interacting with host, and what is the crosstalk going between the bacteria and the host cells. That is the ultimate reality. And there is a much larger view should be seen rather than just looking at the tail or the trunk of the elephant. The story is really big, and we really need some good in-house data, which is lacking. Of course, people are trying towards that. To really, we can really modulate the immune response by changing the microbiota, by adopting the healthy lifestyle. So I think, in my view, there is nothing non-infectious these days. People used to call hypertension, diabetes, obesity as non-infectious diseases. In fact, everything has become infectious or microbes related, because ultimately it is your microbiota which is regulating all these lifestyle disorders. So I think there is a lot to be learned from the research which is going on, and there is a need to have in India and in developing countries their own data which can support the role of probiotics or role of different lifestyle disorders, where we can really use options and therapeutic interventions which are not just conventional. Thank you so much.
Thank you, Professor Chaudhary. From the standpoint of childhood diarrheal disease and probiotic usage, Dinesh, it is very important to understand whether a probiotic is used for the prevention of diarrheal disease or for the treatment of diarrheal disease. For our benefit, in a gist, would you summarize the published data? What helps? What are the strains which have shown to help in prevention and in treatment?
Sure. In the interest of the time, I'll keep it very focused. Consolidating all the meta-analysis, the clear-cut international recommendations have come for the use of probiotics for acute diarrheal management. The data come from the different international bodies like ESPGHAN, NICE guidelines, WGO guidelines, and Latin American Gastroenterology Society. So what they're clearly telling us is there are two strains which have got a good benefit for the management of acute diarrhea. That is Lactobacillus GG and Saccharomyces boulardii. And this is a class 1A evidence. And they reduce the diarrhea by 1 day. And then Saccharomyces boulardii is also known to decrease the incidence of diarrhea by reducing it, by lessening the prolonging diarrhea by more than 4 days. So basically, the questions we are asking is one day that is going to be helpful? Yes, if you are a working mother or a working parent, reduction in the 1 day of diarrhea would be helpful. So this is what the evidence is there for the management of acute diarrhea. Regarding the prevention of diarrhea, sound scientific evidence has come up from the Indian studies. Saswal has looked into 600 odd children, and there's data from Shore using Lactobacillus casei shiroti. She has shown that there is a prevention of diarrhea is prevented by 14%, especially when used as a prophylaxis. So, but there is no clear-cut international recommendation as such for the prevention of diarrhea.
Moving from diarrhea to exactly the opposite problem, constipation. We have always heard of probiotics in relation to diarrhea. Is there any published data about probiotics in relation to constipation? If so, adults versus children, how does it compare? And which strains are specifically?
I think this stems from the concept of dysbiosis. Dysbiosis leading to constipation. I think all over yesterday and today we have been talking about intestinal dysbiosis. The data on children regarding use of probiotics for constipation is scarce. Most of the data come from an adult and mostly from Lactobacillus casei shiroti strain, which has been used and shown to be of beneficial, especially in management of constipation in adults. But we do not have as much as data in children.
Thank you, Dinesh. Dr. Bhargav, from an adult standpoint, we have heard about several indications in GI practice by the speakers in the clinical session. But are there any other indications of probiotic use in GI? For example, irritable bowel syndrome or any other indications where probiotics have been shown to offer possible benefit?
Okay, thank you, Sarath. I think I'll give a more general statement as to how, as a clinical gastroenterologist, I'm looking at this. Because in general, all of you follow the data on probiotics more than me. I generally get my information from first-hand review articles that I read on. And the way I look at it is the following. Studies currently in probiotics remain very small and conflicting. There are some exceptions like the one from Lancet, and I'll mention another one from the Lancet on acute pancreatitis, knowing that Dr. Rakesh Tandon is in the crowd. Of course, diseases are all different. You cannot apply the same principles to every single disorder. Of course, strains are also different. So the bacteria that affect us and the bacteria that are likely to benefit us remain different. So we cannot apply the same rules to everybody and everything. Of course, data, let me just give you an example. Again, there's a Lancet study, nicely done, almost 300 patients on acute severe pancreatitis patients. And again, the study showed an increased risk of death when probiotics were given. So here's, a relatively innocuous, and I'll get to that in just a second, a relatively innocuous group of drug or supplement or fermented product or whatever you want to call it, where this study showed that there's damage to be done. So we have to be careful. Of course, if you look at the gastroenterology, and now coming to Sarath's issue, if you look at the gastroenterology data, there's data that is accumulated from the childhood diarrheas, of which has been beautifully shown that they benefit, to adult diarrheas where we're not really so sure. IBS, again, studies are there from using VSL-3, and there is some benefit that is coming across most of the trials. However, no clear recommendations are given. That is a population that is relatively healthy, but we're trying to improve their quality of life, and I think probiotics might have a role in that. IBD, you've heard enough. I'm not going to delve into details. There are some benefits. However, again, studies remain small and inconclusive. Traveler's diarrhea, haven't touched on, but there was one small study done on British soldiers who were sort of traveling out of England, and that again did not really show much of a benefit. However, it remains on the cards as to whether it shows benefit or not. I know there are other non-GI indications that are being looked at, but again, now children are exceptions. There's clear data on acute rotavirus diarrhea. It's very clear. They are of significant benefit, and one must not hesitate to use them. Now, what should one do now that I've confused all of you? And what do I do? Because these probiotics have generated an incredible amount of public attention. And when any product generates that much public attention, we have to be careful. Of course, it's going to be used and abused, and some right, some wrong. So the first and foremost rule that I try and follow in my practice is, let's do no harm. And if you look across all review articles, there was one publication from Boyle, which basically went out and said, what are the minor and what are the major sort of risk factors to using probiotics? And in the major risk factors, he sort of mentioned that if you have a heavily immunocompromised patient or an end-stage cancer patient, and the way I interpret it, if you have a very, very sick patient, then perhaps this is not the way to go. Or if you have a preterm baby. Now, I don't want to comment on that. I'm not a pediatrician and I cannot say anything, but that's what's written in the review article. The other minor risk factors that were brought about was any patients that have central lines. We have to be careful. Any patients who are being fed through jejunostomies, because you may give a dose of a probiotic that is X billion, but yet you've already bypassed, the stomach and the first part of the intestine, and you fed into the jejunum. God knows if that dose is going to be of toxic, range. I don't know that, but that's word of caution. Then there are these populations that have cardiac valvular disease and massive acute diarrheas. That's where we have to be a little careful. And of course, heavy gun antibiotics ongoing in the ICU, in those settings. I think we have to be careful. And apart from that, I think, Sarath, honestly speaking, these are lifestyle modification mostly. We're looking for some acute conditions where these drugs would help. And that's how I sort of maintain my practice.
Thank you, Sandeep. Ishi, you work in the area of celiac disease. Where do probiotics fit in?
Yeah, well, celiac disease is a gluten intolerance, as most of you would understand. And the role of probiotics has been found to be very useful in many studies and also in my clinical practice. And what I would say is I will take it beyond celiac and talk about what I'm seeing as a very new and emerging entity called non-celiac gluten intolerance. And both are, whether it's celiac or non-celiac, are highly inflammatory conditions. So I think the role of probiotics perhaps is coming from its benefit as an anti-inflammatory effect, or of course we find severe nutritional deficiencies in both celiac and non-celiac. We find extremely low iron levels, very often with even normal hemoglobins, low ferritins, we find low magnesium, we find low vitamin B12. So the role of probiotics in absorption of nutrients has been shown in several animal and human studies. And so also, I guess, in these cases, perhaps one of the reasons to their benefit is in their nutritional absorption and helping also in, of course, the digestive symptoms, whether it is diarrhea, whether it is IBS-related symptoms or constipation or reflux. I think they do very well with the probiotics. And there are studies to support this as well.
Thank you, Ishi. At this stage, if there are any questions from the audience directed to a specific panelist. Okay. Any questions from the audience? No. Professor Lee, we always look at probiotic intervention in the area and the place we reside. But as a person not representing India, as an outsider to this country, how do you view the possible preventive role of probiotics, the indications where it could be used in a country like India, which would apply to many regions of South Asia?
Sure. In fact, the Asian is a good model for studying probiotics, and in particular India more so, because you have a very diverse the geography demarcations. You have different races, different diets, and you have the whole host of different diseases.
Is it audible to everybody?
Can you hear? Yes. So therefore, I thought this is a good place to study probiotics, and especially in the prevention of properties of probiotic in diseases. That, in fact, if I'm going to conduct clinical trial, I'll come to India.
Professor Pott, in a gist, can you educate us about the gut-brain association? How can it be, from a practical standpoint, how can it be put into effect and utilized?
Well, I'm not at all a gut-brain expert, but there's a lot of literature coming up which shows that there is actually a number of signaling molecules which are generated in the intestine, which can actually be transferred to the brain and trigger some specific responses. Now, one of the things that I heard recently was, it's more a hypothesis which needs to be verified, is that actually toxins from the intestine can be accumulated in the brain. And that would actually be the cause of autism, as it has been hypothesized, and I must stress this is still a hypothesis. But what happens is that when the development of the microbiota at an early age is not sufficient, it would have an effect on the immune system, as we have discussed yesterday. But a second aspect, that also the metabolites that are generated in an imperfect microbiota might have toxic effects on the body, including down to the brain. And in this case, that would be the cause of some of the stress factors that have been mentioned as well, could also be cause of this kind of metabolites, which accumulate in the brain and are the cause of factors like autism.
Thank you. Professor Yokota, the relation between the gut microbiota and bile acids, which is what you presented on also, from a clinical standpoint, from a practical application standpoint, would you be able to summarize for us the specific indications, how they could be put to clinical use?
Well, the bile acids affect the gut microbiota population, and but I think the situation is very, very complicated, and the bile acid not only affect gut microbiota, but also affects the host metabolism by acting as a signaling molecule. And the bile acids are also underwent biotransformation by gut microbiota. So the situation is not one way, but back and forth. So also the diet interacts for the host bile acid secretion. So I think situation is that the probably the gut microbiota has been affected not only from bile acid, but mainly from the diet component. And after that, the bile acids component has been changed by the its bacterial transformation, and the bacteria has been changed by the bile acids, so back and forth. But these days, bile acid has been recognized as the signaling molecule regulating the host lipid sugar cholesterol metabolism. So I think these interactions should be normalized by the balanced gut microorganism composition of the gut microbiota, which in turn should be normalized by the diet composition, so that the bile acid excretion should not increase too much. But the situation is, I think, the experiment or investigation of the bile acid field is rather not well organized still, because sometimes people use too much high concentration of bile in an animal trial or some in vitro experiment, which sometimes results in not physiologic results, or rather other way around sometimes. So,
Thank you. Any focus questions from the audience once again?
I have one for Professor Bruno Pons.
Yes.
See, the autistic children, from what I've read in the literature, there's a ratio of the spectrum of the microbiota is different from normal. Is it the cause or the effect?
Well, I heard this talk I was mentioning was Dr. Natasha Campbell. She's a neuro specialist, actually, and she didn't know anything about microbiota, but she was confronted with the autism spectrum disorder more and more, because it's really going up like obesity. We can see also in the US and Europe, we can see the number of patients with autism spectrum disorder going up very dramatically. And she made the link to the microbiota because of the literature that recently came up, and she, as a person completely strange to microbiota research, she started to read, let's say, as an outsider. And her conclusion was really that the quality of the microbiota would have an influence. Probably it will be at the early age. So in this respect, it could be a causal effect. Her hypothesis is that during generations, we have accumulated some also epigenetic changes through the use of antibiotics. That's her theory. Through the use of antibiotics, the quality of the microbiota has, from generation to generation, gotten worse. And now this is as a result, she says, we don't have the same metabolic potential anymore as we had with the diet, let's say, 100, 150 years ago. And as a result, there is less removal of toxic compounds, which are taken by the food, but also as a result of the metabolism of the microbiota. And it's the accumulation of these toxins, which she says has been measured in the brain and is probably the cause of some of the autism spectrum disorders that we see currently increasing. Because there couldn't be any genetic reason that explain the fast rate at which we can see this spectrum autism disorder number being going up. So she would rather say that it is the causal effect. But again, I'm not a specialist at all in that area.
Yes, Professor Lee.
I want to add.
Yes.
Can I comment a bit? I would like to perhaps contribute to this, because we are also interested in autism, and we work with autism schools and children on these particular aspects. And the present suspicion is that the microbiota that involved in the productions of some short-chain fatty acid in huge quantity, for example, the pyruvic acids. And this is really an irony, because short-chain fatty acids such as butyric acid, pyruvic acid, and so on has been claimed to be beneficial. For example, induce apoptosis of cancer cells and so on. But however, the pattern tilts and it becomes overproduced to above certain quantity, it may induce changes in the neural functions and mental stage, which result in perhaps autism. And we are looking into this hypothesis and perhaps working on it. And in fact, we welcome Indian colleagues who are interested in this aspect to perhaps work together in elucidating the roles of microbiota in autism. If it is true, then perhaps it is important as well.
Yes.
I just want to add regarding to autism. There has been a trial in US where this is a crossover study where they tried to give in the autism patient probiotics for 6 months, and they were to cross over to placebo. In fact, the study was so fruitful that parents noticed so much of behavioral changes in their children that they refused to continue the study after 6 months, and they said they were very happy with the probiotic therapy because the children were showing very good response. So the study has to be terminated halfway, and it could not be crossed over to the placebo because of the good results which were coming up. So this is from published literature, and there is definite evidence in autism.
Thank you, Professor Chaudhary.
Thank you.
In the interest of time, I'll have to close the panel discussion now, and I thank all our panelists for contributing to the content of this panel discussion.
Thank
you very much.
Dr. Gopalan, for